Hi, Tristan.
Hi.
Do you want to come on back?
Sure.
Okay. My name is Mary, and I'm going to be your nurse today. So, can you tell me what brought you in?
Yeah, so I'm just bringing in my son Timmy here. He hasn't been feeling really well lately, and I was just really concerned because he passed out earlier this morning, and
Okay.
that's just not like him at all.
Yeah. Okay. Can you tell me about some of his other symptoms?
Yeah, so earlier this week, we came in because he was really sick, and the doctor diagnosed him with gastroenteritis. And so they just sent us home to kind of recover there, um so I gave him some Pepto-Bismol because he was having some diarrhea, and he seemed to be doing fine, but then like 4 days later, about he started like throwing up and just
Um,
being like super irritable and lethargic, and he's not like that at all. So
okay,
it
so you
just didn't
noticed a
seem like him.
difference. You noticed a difference in like his kind of mental state, maybe?
Yeah,
Okay.
yeah, for sure. And then I wasn't like, I thought maybe it was just kind of like some of those symptoms that the doctor had talked about that's that goes along with gastroenteritis, but then when he passed out, I was like, I don't think this is normal.
Yeah,
So
definitely. Well, I'm glad you brought him in. So I'm gonna have you lay Timmy down onto the bed. We're going to turn the lights down a little bit dim. I'm just concerned because you mentioned that he is acting differently. I'm concerned that maybe
mhm.
he had some sort of head trauma or something that's kind of um, making his level of consciousness a little bit
Okay.
different. So we're gonna lay him down. We're gonna raise the head of the bed up um, 30 degrees, and I just want you to make sure, if you can, to try to keep his head midline, so he doesn't
Okay.
turn it like this. Um,
Okay.
and we're just gonna try to keep the environment really calm for him. Do you think you can
Okay.
do that for me?
Yeah, of
Okay,
course.
great.
Okay.
Next thing I'm going to do is I'm just going to take his vital signs. So I'm going to listen to
Okay.
his heart and lungs and all that stuff. Okay. Okay. So I'm noticing that we have some a little bit altered vital signs. So looks like he's definitely um, going through something. He's got a high temperature, kind of a low blood pressure. So that's what I'm most worried about right now. So I'm gonna also take his glucose, just get a little finger stick on him just to check his blood sugar. If that's
Okay.
okay. Um, okay. And we got that back. And it looks like he's a little bit hypoglycemic, so he has low blood sugar. So what I'm
Okay.
gonna do is I'm gonna start an IV on him and get him some fluids and get him some um, fluids with glucose in them, so we can up his blood sugar. Okay.
Okay. Is everything okay? It sounds really serious.
So something that I'm concerned about, and I'm also going to call a neurologist in just to kind of check him out and maybe double check what I'm thinking. But something that's really important. Have you ever heard of a syndrome called Reye syndrome?
Mm-mm.
Okay. Have you ever heard that it's not okay to give your kids aspirin? Do you know about
Oh,
that?
yeah, I've heard of that. I think they said something like way back when we took him from the hospital after he was born.
Yeah. So something that's really important. There's a component in aspirin, or aspirins are considered a salicylate,
Mm-hmm.
which is kind of just an ingredient in the drug. And something that also has salicylates is Pepto-Bismol as well.
Oh, okay.
So it's really important. That can actually harm your child and can give them something that's called Reye syndrome, which is something I'm concerned about right now. So we're just going to go through all the precautions just to make sure it's not anything else, but I want to treat him kind of like it is, just to make sure that
Okay.
we take good care of him. So I'm going to be giving him those fluids, and it's just really important to stay calm and everything. So he's not overstimulated, because something that can
Okay.
also happen is he might be experiencing some cerebral edema or like swelling inside his head. And so that might be something that caused him to pass out and caused him to act a little bit more irritable. Because that's the first sign of that cerebral edema, is kind of an alteration in his normal level of consciousness.
Okay. Oh, I
Yeah,
feel so bad that he's here because of me.
I know. I'm sorry. You must be really, really worried right now.
Well, whatever I can do to help, I'm just glad we're here and I'm glad you're helping
Yeah,
us.
you did the right thing by bringing him in. That was a really good idea for you to do that. So I'm going to go check in with the neurologist and get some things ready. Do you have any questions before I go?
I don't think so.
Okay, sounds good. Okay, so I got some instruction from the doctor. So I'm going to pull some, I'm going to take a little bit of Timmy's blood, and we're going to test
Okay.
that just to see. Sometimes in Reye syndrome, a child might have liver damage, and so we can pull the blood and test the blood for that to see. We'll also test his just electrolytes and see if we need to get him some different types of fluids to kind of balance those out. And then we also want to see if he has any liver damage, if there's going to be any issues with his bleeding or his clotting abilities.
Okay.
So I have that IV in. I'm just going to pull some blood right now. Okay, perfect. And I'll go send that to the lab. And then we'll see what that comes back with. And then another thing that the doctor wanted me to do is to give mannitol. Have you ever heard what that is?
No.
Okay, so it's a diuretic, which means it's going to cause Timmy to lose some fluid. But in this case, that's a good thing because we want that pressure to decrease in his head.
Okay.
So I'm gonna give him some mannitol. Do you know how much Timmy weighs right now?
Oh, he's about 18 kilograms.
Okay, perfect. So the doctor said that I can start by giving him 1 gram per kilogram for the whole day. So we'll start with
Okay.
that, and I'll start that.
And this is safe for him?
Yeah, we'll have to keep a really close eye on him to make sure that his level of consciousness doesn't change, and that he's got enough fluids in his body, but doesn't have too much. So it's going to take some a pretty close eye on him just to make sure that he's going to be safe and not going to have any brain damage or anything like
Okay.
that. Okay. All right. So we'll get started on that. And I just want to reiterate to you just the importance of understanding what medications you're giving to your children. So it's good that you knew that aspirin is not okay, but it can be really confusing to know what is in other drugs. And I understand that you are trying to give Pepto Bismol to kind of help his upset stomach. But unfortunately, that does have the salicylates in it as well. So
Okay.
I think it's really important just to check in with your primary care provider before you're going to give any medications
Okay.
to your kids. Okay.
Okay.
Yeah, and just because this Reye syndrome can be really scary, and it actually can result in some neurological defects or kind of brain damage if we didn't treat it right away. So it was great that you came in as soon as you noticed something different, and we could treat him pretty aggressively. That's really important
Okay.
in trying to get the best outcomes for him. So you definitely did the right thing by coming in today.
Okay. Yeah, that's good to know because he starts kindergarten later this year, so
Yeah.
we don't want him to be behind.
Yeah, definitely. Do you have any other questions for me?
I don't think so.
Okay, sounds good.
I think you answered my questions. I'll make sure to check those ingredient labels before, and then check with the doctor too before I give anything that they didn't say to give.
Perfect. Okay. Well, let me know if you have any other questions.
Okay, I will. Thank you,
Okay,
Mary.
take care.
Bye.
Bye.